On the surface, Emilee seems like the picture of perfect health, but things don't always appear as they seem. On the inside, she was far from your typical young woman.
6 months after Shane and I got married, we got pregnant, and then a couple weeks later, I miscarried. I was devastated. We decided to try again, and we got pregnant. At 31 weeks, I started having complications. After 6 days, Porter was born on March 16th. I was just thrilled. I decided that I would donate my eggs to help someone else. While I was getting my exam, the doctor looked up at me and said, "Did you know that you had 2 cervixes?" I was just like, what? I was diagnosed with uterine didelphys, which means I have 2 uteruses, 2 cervixes, and then 2 vaginal canals that are split by a septum. It's not something you can see on the outside. They told me I had a higher risk of miscarriage and preterm labor. We ended up miscarrying. After that, we got pregnant immediately again, and we miscarried again. This was our 3rd miscarriage.
We didn't get hopeful because we were always expecting it to not work out.
And we got pregnant again for the 5th time at 29 weeks. My water had broken. So after 10 days in the hospital, Kendall was born. She was diagnosed with cerebral palsy. It was devastating. We were thinking we couldn't do this again.
To call it quits, it's crushing.
We just imagined having this big family.
After struggling with multiple miscarriages, Emilee was desperate to find answers about her condition, so we sent her to fertility specialist Dr. Tina Koopersmith.
Emilee? Hi, Emilee.
Hi.
Nice to see you. So you've been through a lot, and you're only 23, and you want more babies. You've got a lot more years ahead of you.
Yeah, I love babies.
25% of the time when someone has recurrent miscarriages, we find uterine abnormalities. And so we need to figure out if this uterus is contributing to those 3 miscarriages or the preterm labor. I'm trying to look at her cervix and the septum. It's not asymmetrical, and it's very central. So I'm gonna do an ultrasound. This is the inside cavity of one uterus, and this is the other uterus. I'm measuring the length and the height. So Emilee, she's gone on for several years thinking she had 2 uteri completely. On quick glance, I see 1 uterus with 2 separate cavities within the uterus. That suggests to me a very different diagnosis. So I want to review these images and then sit down with you.
Awesome, thank you.
We're joined now by Emilee, along with fertility specialist Dr. Tina Koopersmith. Thank you for being here. And you found something you weren't quite expecting, and I think we're all sort of hanging on those words. What did you find, and what is going on with Emilee?
The first thing I saw when I put the ultrasound probe in is really a normal uterus is sort of a T, and she basically has a T with the littlest divot in the top, and then inside that normal-shaped uterus, she has 2 cavities. So she was told at the time of her C-section that she had a heart-shaped uterus, and indeed that's what she really has on the outside. It's really 1 uterus with a heart on top. The inside is a failure of fusion. So she has 2 cavities on the inside, and you can measure kind of this half of the uterus, and then you scan over to the other half of the uterus. They're fairly equal in size. And what's in between, I'm still kind of trying to decide if it's muscle or a true septum in between.
Okay, so given these things, Dr. Koopersmith, how does that change things, if at all?
I think it changes things a lot. When you hear of people with the septate uterus, they're at an 80% risk of miscarriage. If it truly is a septum and I can cut the septum, she flips to an 80% term birth and a 20% miscarriage rate.
So you literally completely flip the statistics so that you go to a point where the likelihood of pregnancy is quite high. And again, I know you still have more investigating to do, but how does that feel hearing that?
Being able to have better percentages of carrying full term is just so hopeful for me to hear.
When an individual has a double uterus, there really isn't a surgical option. You now have options, so this is really good news.
And Dr. Koopersmith, where does someone like Emilee go from here?
I think I would rather do an ultrasound at a slightly different stage in the cycle. It would help us see the inner cavities a little bit better. Alternatively, we may do an MRI. Might give us more information to decide what kind of surgical option you can choose.